how this helped. Now I want to say first of all that LifeWays is not to treat any specific diseases. We don't say it's designed to treat any specific conditions. So this is a disclaimer, okay? I'm finding this helps my patients, but you really have to talk to your own doctor about these things. But this, I'm showing you that in my practice, this is working. So these are 3 patients you can see without the patch, with the patch. So we have 2 patients with the patch, 1 without, and let's follow them forward. This is beforehand, okay? This is 6 days after. Now, without the patch, you see that redness? That's what I'm used to seeing in patients. Now, with the patch, this is 6 days after. Look how little redness there is in the face and less yellowing of the skin. And here we are at 10 days after, and I have to say, at 10 days, you see that redness on the skin on the with the patient on the right without the patch, and the people with the patch, they're almost healed at 10 days, and they almost look like a patient a month after surgery. Let me show you this. So these patients look like a month after surgery, only 10 days after, and this is the power of the X39 patch. These 2 patients were actually using it for a month before the procedure. And here we can see the way that 10 days look like in these patients with the patch looks like 5 weeks without the patch. So they're healing much faster. And I want to thank you so much for your attention. I have a book on Amazon called The True Definition of Beauty. It's a Wall Street Journal bestseller. And if you're interested in part of the talk that we had here, you can definitely get that yourself. And thanks so much for your attention. Okay, continuing on with our presentation now, we're going to talk a little bit about photobiomodulation and the X39 patch. So I thought you found it very interesting, my first talk, talking about how I introduced it to my practice and how it's helped people heal faster. Let's talk about the science about this, of how does X39 actually work. So there's actually a study done, a research done with Connors, Caitlin Connor, Melinda Connor, David Yu, Jens Eickhoff, Susan Wagner, and Amy Chang. It was published in Internal Medicine Research at that date in that volume. This was the paper. It was a double-blind testing of a patch to determine if it could affect copper peptide production. And it was double-blinded. It was randomized with people not wearing the patch and with the patch. And over about a week, they checked the copper level in the blood. And it's actually presented to the U.S. Patent Office because it was so innovative. They're getting a patent for this technology. So 60 people were randomized in 2 groups. One tube of blood was drawn. And there was a significant increase in the copper peptide found when compared to the controlled group. And then more was taken at 24 hours and 7 days, and actually showed even more of an improvement. So let's just talk about, not about the study, about the X39 necessarily, but first about copper peptide. So it was first isolated by Dr. Lauren Bacart in 1973. It belongs to a group of emergency response molecules, which when we have an injury, these are produced, and that recruits healing cells to an area. And it's naturally to any injured tissue, and it's shown to have a therapeutic role in age-related neurodegeneration and cognitive decline. This is interesting. So I'm not talking about X39 now, we're just talking about copper peptide. Copper peptide, which we've been showing that X39 actually increases, but let's talk about copper peptide itself. Actually helps people with diabetic neurodegeneration, like diabetic neuropathy, and helps with axon survival and the maintenance of nerves. So that's very interesting. It activates stem cells, accelerates wound healing. I was showing you that before in my study. It's beneficial for hair, skin, nails, both growth and repair. It tightens loose skin, reduce fine lines in the depth of wrinkles, and smooth rough skin. So what are some of the actions of this? Well, number 1, it's antioxidant, anti-inflammatory. So we've heard about inflammation being a problem with aging. How much would we like to decrease inflammation if we could take a pill through this? What if just a patch could do this? We're not really talking about the patch right now. We're just talking about copper peptide. There's a lot of research on this. This antioxidant is anti-inflammatory. This is interesting, but it beneficially alters the expression of human genes for nerves by 15%. So we have a set of genes, okay? And neuron function is set by these genes, and this can actually turn that neuron function on by about 50% better under the effects of copper peptide. And it induces strong anti-anxiety, anti-aggression, anti-pain activity within 12 minutes in a study of rats. I've actually seen this in my patients and in a colleague where a colleague of mine put a patch on him. He had problems with back pain. 3 hours later, his pain was down 75%, which was amazing. And we've actually seen a lot of people say, they put it on and they feel calmer within a few minutes. And that's why, because copper peptide, okay, we're not talking about the X39 right now. We're just talking we're going to get back to it, but copper peptide, if you could somehow increase copper peptide, you'll have strong anti-anxiety and anti-pain. And that's kind of what the patch is doing on these two examples that I mentioned. So we never want to have a case where we have an intracerebral hemorrhage, because what happens is nerves die. That's what apoptosis means. But if they have high levels of copper peptide, less nerves die in a case of intracerebral bleeding or hemorrhage. It's implicated in resetting almost 4,200 genes to a younger, healthier state. And it's the copper peptide is the #1 bioactive compound recommended for the treatment of lung disease, COPD. We'll talk about that. It resets the programmed cell death in several types of cancer. Okay, now, we're not going to make any medical claims here, okay? But the research has shown, so in a cancer situation, if I'm a cell, the cell to my left of me, to my right of me, to my in front of me, and back of me, on top of me, behind and below me, actually tell me to stop dividing. Say, hey, we have enough cells here. What happens is, if I'm the cancer cell, I keep multiplying. I'm not really encumbered by all these cells around me. And if you have high copper peptide, it actually tells that cancer cell, hey, stop multiplying, and actually you can die at this point. So it's not saying this cures cancer, but in research it's been shown that this happens. And we've never seen any side effects with this. Sometimes people say that they feel maybe a little more tired or headache or something. That's usually just pushing out toxins, but the copper peptide itself really has not shown to any side effects or issues. It's been used in humans for the treatment of damaged spines segments in the neck. So we're just putting it on the skin, the patch, but they've actually had it in injections, copper peptide. They inject it around the damaged area, and they've actually helped fuse damaged spinal segments. And this is interesting. This sort of complicated sentence about alginate hydrogel. So what they're doing with mesenchymal stem cells, MCS, okay, they're trying to grow have bone growth happen. And they'll put a gel on top of the broken bone. And they found that with elevated copper peptide, you have more enhanced ability to regrow the bone when it's put on a broken bone. And increases healing speed of, here it is, skin, stomach, intestinal lining, bone, and tissue. It strongly chemotracts capillary cells, mast cells, and macrophages. So if we have a lot of copper peptide in an area, it says to the capillary cells, hey, come over here, grow this way. Come on, mast cells, macrophages, come over here, start working over here. And that's ways that we can get faster healing. I think that's what's happening in my patients when I do these procedures, why they're healing faster. We have a gene set that is set for cleaning out the cellular debris, something called the ubiquitin proteasome system. And if you have a lot of copper peptide, okay, not talking about the patch itself right now, just if you have a lot of copper peptide, the research shows that it activates the genes to clean out our cells. Well, who doesn't need a cleaning out of damage in our own cells? I do. Cortisone is used for inflammation, so people use it in the joints. The problem is, when it's injected into a joint, it reduces any regeneration during that time period. But if we have high levels of copper peptide in an area, and then you inject the cortisone, and there's a lot of copper peptide there, it blocks the cortisone's anti-regeneration effects. You get the good effect of reducing inflammation without the bad effects of preventing healing. Fibrinogen is a top predictor for cardiovascular and heart disease. And if you have a high level of copper peptide, however you get there, you're actually going to have reduced fibrinogen synthesis. This actually helps heart disease. And also, with people with heart failure, it increases myostatin. So it's helpful for the ninefold. Amazing. So it actually, if you have high levels of copper peptide, however you get there, if you're injecting it or you're drinking it or whatever, you're not drinking it, but the patch does this, but I'm not trying to cone on the patch just yet until we complete the slides with the study. But if you could ever somehow increase copper peptide, you would actually help your heart in multiple ways. And here we are. If you go into PubMed and you put in copper peptide, you're going to find 124 results. Okay, 13 pages. You can read each one. These are all studies looking at copper peptide. This is what I'm saying. Copper peptide does a tremendous amount of things. If we could ever somehow, and we know how, if we could ever somehow increase copper peptide in our body, it has all these incredible downstream effects. So this is the one talking about wound healing in mice. I talked about angiogenesis. I talked about how it recruits vascular cells into an area and say, come over here and help me multiply and grow into this area. That's what I was talking about. This is another one talking about, this is seen here, the NF-kappa beta. That's a molecule that has to do with aging, and it suppresses that. It does a lot of things. This is Lauren Picard publishing in 1918. They're the ones who initially put together this study on copper peptide. So what did the research show? A significant increase of copper peptide in the blood of the active group was seen with a significant p-value. P-value has to do with whether something is better than chance. And a p-value of 0.03 is very, very significant for it not being just due to chance. This is really an effect of the patch from day 2 to day 7. It looks like it took like a day or so for it to increase the levels for it to be seen, but from day 2 to 7 we saw that. So when you put in the skin, what happens? Well, just like sunlight can cause changes, right? Makes us make vitamin D in the skin. These patches can do a similar way by increasing copper peptides. Put on the skin. It reflects back our own infrared energy, and that infrared energy will cause an upregulation of copper peptide, recruit stem cells to the area, and then they go throughout the body wherever there's inflammation, helps heal that area. So here's just a summary to skin and hair. It helps with wound healing. I showed that before in my former presentation. It smooths rough skin, reduced photo damage, modeled hyperpigmentation. We can't say it really helps cancer specifically. The patch does, but copper peptide has helped people, especially with metastatic colon cancer. COPD, copper peptide has helped people with lung disease. It protects lung cells. It increases SOD, superoxide dismutase activity. So that's antioxidant, anti-inflammatory. And here it is about the NF-κB molecule, which is believed to be the primary cause of disease. It suppresses that, which is amazing. This is about the intracerebral hemorrhage that I mentioned. And here's the mention of injecting it around the skin. And look, the cost is incredibly low, just like the X39 is very low. So this is just going over the things we talked about. Okay, and then went for a patent for it. So it repairs our genes. It's anti-aging, converts older cells to a younger state. It helps with wound healing. Like tuning a piano, we need some maintenance. This helps us. So we patch it anywhere on the body. Usually pick behind the top of the spine, behind the neck, or underneath the umbilicus. And it causes an upregulation of these molecules, the copper peptide. Humans glow. This is really interesting. This was a study done in Japan. They actually put people in a very dark room, and we put out light throughout the day. This idea of photobiomodulation, our cells put out light. We can't see it because we're in a lit area, but I think that was really fascinating. Okay, so the benefits, it's really can elevate naturally occurring compounds that declines with age, and that's where the similarities end. It's a first patch that elevates a peptide, copper peptide, which showed all the benefits before, and the results are really stunning. There's an immediate effect through an elevation of antioxidants and decreased inflammation. That's what we've seen in people. More energy, better sleep. People are having improvement in quality of sleep, and they're remembering their dreams. Pain relief. This is actually a text I got from my colleague Alan. He said, Adam, weird, yes. I said, how'd the patch do? He said, I had an epidural last week that failed. I woke up this morning, read a line when he could get it done again. He said it went around 7:15. The nurses, 3 hours later, the nurses never saw me jumping so much. They actually commented on it. My back feels 75% better. I don't understand it. And he says, let's see, he said, I never want to take it off, he said at the end. So this was really interesting. He noticed this in about 3 hours. Certain people take about 6 weeks to have an impact. Certain people about a week. So there's a range, but it definitely helps a lot of people. This woman wore it for about a year, and see how her skin looks better a year later. Her name's Manny. This was fascinating. Sports performance. It helps people with their recover from sports. Hair growth. This is fascinating. This was actually a picture sent by someone showing that her dad's hair grew 6 weeks on the patch. Let me go back here, sorry. And this was interesting. This was, look on the right here. This person was working on rafters. He fell through the ceiling. He had broken ribs and a punctured lung, extreme pain. He expected to heal over about 6 weeks. He was on the patch, healed in about 3 weeks. Same with the finger tip regeneration happened. This woman had facial radiation. It helped her. You can see the dates there. So it speeds recovery. Brain health, this is interesting. It can actually help when we have too much activity or too little activity. That's not good for our brain. It helped make a more moderate brain activity with copper peptide. Scar removal, this was interesting. This was a patient who had a heart surgery, and they went through right through the chest there, and you could see that a year later the scar healed. It was indented, and then a month after using the patch, some of the scar actually filled in. This is another one like this. You could see it was put on the foot. You don't have to put it on the foot, but look, a month later, you see how much healing happened there with the foot after that incision there. And wound healing, and I was actually talking about how that helped me. This is a surgical scar 2 weeks later. Youth renewal, it's amazing. This is my book. I'm going to just go through once again. I can't say it helps specific diseases. I was showing you, this is my patients before without a patch on the left, with the patch. And let's take you through the procedure. We use lasers to improve their skin. See how red they are without the patch, and with the patch, see how there's very little redness and the healing is much more advanced. At 10 days after surgery, they looked, my patients on the right, who both had the patch, looked like they were about a month after surgery, and the patient on the left is without the patch. And now keep going. At a month later, this is 5 weeks later, looks great, but these people at 10 days look as good as this woman looked at a month. So this was really amazing how this helped heal my patients. And I really want to thank you for your attention, and I hope you found this interesting. And you can definitely look me up, and you can get this book if you're interested. And thank you so much for your attention.